My name is Emily. I'm going to be inserting a Foley catheter today. So I have checked my provider's orders and they say to insert an indwelling Foley catheter in Bob Smith, room 2, 1992. It's his date of birth. So I am going to go ahead and gather my materials. So I have my Foley catheter kit here, and it is intact and not expired. Expiration February 28th, 2025. So I'm gonna go ahead and go into my patient's room. Knock, knock, knock. Hi, I'm Emily. I'm gonna be the student nurse taking care of you today. I am going to be inserting a Foley catheter to help you urinate. I'm gonna provide privacy and perform hand hygiene. And then, Mr. Smith, could you just tell me your first and last name and your date of birth, please? Bob Smith, 1992. Perfect. And your bed is at a good height for me to be working. So I'm just gonna go ahead and put on clean gloves and then help the patient clean their perineal area with soap and water. Okay. And then I'm gonna go ahead and make sure that they're in an appropriate position for me. And then take off my clean gloves and perform hand hygiene. And then go ahead and open my Foley catheter kit. So I have my sterile field here. It is clean and dry and it is above my waist. So I am just going to open my catheter kit. And this can go in the trash. And this can go in the trash. And then I'm gonna open it away from me. So I'm just gonna go ahead and turn the kit this way and open it. And I am using the 1-inch border around the kit so that I keep the inside sterile. And I am just going to move it around like this. Okay. I am going to go ahead and don my sterile gloves. And I use the 1-inch border to open these as well. And I'm going to put on my dominant hand first and just make sure to avoid any rolling onto my hand. Perfect. And then I'm going to don my non-dominant hand, and I'm just going to use 3 fingers, avoiding my thumb and my pinky from touching the non-sterile part of the glove. There we go. Perfect. And now I'm just going to kind of adjust here. Okay. And then keep them above my waist. And I am going to use this drape to drape the patient while it's still sterile. I'm just going to get it ready. Okay. All right, and now I'm just gonna inspect the rest of my kit. I'm gonna go ahead and move this to the side here, avoiding that 1-inch border. And then I am going to take out everything. Okay, I'm gonna throw this in the trash. And then I am going to insert my syringe to fill up my balloon. Throw this in the trash. So that it's ready. Okay, perfect. And now I'm just gonna put the iodine on the swabs here. And I am going to go ahead and make my non-dominant hand unsterile so that I can clean the patient. So I'm just going to open the labia. And then I'm going to use one swab to clean the furthest inner labia from me. Throw it in the trash. Another swab for the closest inner labia to me in the trash. And then one swab for the middle. And in the trash. All right. And then could I just have you help me get the loop for the catheter, please? Okay. I'm just gonna put it down. Okay. And now I am going to insert the catheter, keeping it sterile. Keeping the catheter sterile. And now I see urine, so I'm gonna go 1 to 2 more inches. Perfect. And now I am just going to hold this secure with my non-dominant hand and insert the 10 mLs for the balloon. And then give it a little tug gently to make sure to secure. I'm going to take off my syringe and put it in the trash. And then I am going to attach the bag to a part of the bed that does not move. And then I am going to attach this part of the catheter to the inside of her thigh using a stat lock. And then I will put this part on the bed sheet and just make sure that everything is nice from the patient to the bag. And then I am going to ask the patient if there's anything they need from me. Go ahead and take off the drape. Take it off and cover them up. Is there anything else you need from me? Here's your call light. I'm going to lower your bed to the lowest position. Use your call light if you experience any burning, and if you notice any bleeding or anything. Go ahead and call me for that, and I will be in. Okay, so I'm gonna go ahead and leave the patient. I will perform hand hygiene, and then for documenting, I will document the date and time that the catheter is inserted, the reason for insertion, the size of the catheter, how the patient tolerated the procedure, how many mLs I inflated the balloon with, and the color and amount of urine that drained into the catheter bag. And that's it.